The COVID-19 pandemic has placed a great strain on everyone's mental health. Across Europe, as countries have moved in and out of lockdowns, many of us have dealt with overwork or unemployment, anxiety, stress, and most of all, grief. Before the pandemic, 84 million people in Europe were living with mental health problems. This figure is on the rise, with the numbers of people reporting depression up by just under 2/3, anxiety up by nearly 3/4, and sleep problems up by more than 1/3. Every individual is affected, across all ages. Children's mental health has been adversely affected, with school closures playing their part. Mental health of young workers who lost their jobs since the start of the pandemic was twice as likely to be affected. 1 in 3 elderly people experienced increased anxiety because they worried about contracting COVID-19 and the safety of their family. Ethnic minorities, LGBTQ+, healthcare workers and people living in institutions, among others, have had their mental health disproportionately impacted. The pandemic has shown that our mental health is more important than ever and impacted by a wide combination of social, economic and environmental factors in a person's life. As humans, we have a collective responsibility to look after our own mental health as well as looking out for those around us. And that collective responsibility includes national governments and pan-European bodies across the EU, who must make mental health a priority across all policy areas as they plan the recovery from the pandemic. Because wherever you are, mental health matters.